Do any of these clips or scenarios look familiar to you? Players are going down more often during their athletic events due to anterior cruciate ligament injuries. Because of the increased physicality and level of competition, ACL injuries are common amongst young athletes. Knowing how to prevent this time-consuming injury can be very helpful. In my informative speech, I will summarize the function of the anterior cruciate ligament and provide information on an injury to this ligament. I will also talk about treatments, surgery process, new studies, and return to sports. So what is the ACL even? Well, the article Anterior Cruciate Ligament ACL Injury or Tear, published by Johns Hopkins Hospital, says, quote, the ACL controls how far forward the tibia can move relative to the femur, end quote. There are two ligaments inside of your knee that cross each other. They are called, quote, the anterior cruciate ligament ACL and the posterior cruciate ligament PCL. Both ligaments attach on one side to the end of the thigh bone and on the other to the top of the shin bone, end quote, from ACL Injury or Tear article. There are many ways someone can tear their ACL, but, quote, the most common is that of a sudden pivoting or cutting maneuver, end quote, from ACL Injury or Tear article. There are also many symptoms that an ACL tear can have. Quote, the most common, quote, a pop in the knee at time of injury, swelling of the knee, and instability of the knee, end quote, from ACL Injury or Tear article. There are also different grade levels an ACL injury can be classified as. Grade 1 injuries are, quote, ACLs that have suffered mild damage. The ACL is mildly stretched but still provides adequate stability to the knee joint, end quote, from ACL Injury or Tear article. This grade level is the least severe and there is no excessive harm done to the ligament. The next grade level is 2, which is, quote, an ACL that is stretched and partially torn, end quote, from ACL Injury or Tear article. Treatment options for a partially torn ACL vary, as some can be treated without surgery. Grade 3 and the last grade level is, quote, when the ACL is completely in half and is no longer providing any stability to the knee joint, end quote, from ACL Injury or Tear article. Using x-rays and MRIs allow a patient to receive their diagnosis and make decisions on treatment. Knowing the severity of an ACL injury is important when deciding treatment options. Quote, treatment options are based on the patient's symptom, type of injury to the ligament, and the type of sport and activity goals, end quote, from ACL Injury or Tear article. If surgery is chosen, the process is long, as the graft used to replace the ACL takes a long time to heal. Kylie and Hewitt in the article, should return to sport be delayed until 2 years after anterior cruciate ligament and reconstruction biological and functional considerations, states that the ACL must, quote, undergo repopulation and proliferation of cells to successfully restore the properties of the ligament, end quote. In simple terms, this means that the ligament has low blood flow in your knee and this takes a lot of time to heal. Kylie and Hewitt compared ligamentization, those of animals, to humans, saying, quote, the ligamentization process occurs in humans over a much longer duration than originally observed in animal studies, end quote. Reconstruction surgery is divided into 3 phases. Browning ear gain in the article Rehabilitation and Return to Play After Anterior Cruciate Ligament Reconstruction lists the 3 stages as, quote, early postoperative stage, strengthening and neuromuscular control stage, and return to activity in sports stage, end quote. Now that I have talked about the treatment options for different patients, I will go more into detail about the surgery process. But what needs to happen before surgery? If surgery is chosen, there's a long process ahead. There are pre-surgical goals the patient first must meet in order to be ready for surgery. In the article, ACL Reconstruction Rehabilitation, Clinical Data, Biological Hearing, and Criterion-Based Milestones to Inform a Return to Sport Guideline, Alexander Brindley states, quote, meeting all pre-surgical milestones has been associated with improved long-term outcomes after ACL reconstruction, end quote. Taking the time needed to prepare for surgery and getting the swelling down will help for better outcomes after surgery, which I will talk about now. After surgery, the post-operative stage is the first 4 to 6 weeks after surgery. Quote, the main goals of this stage are to control pain swelling, protect healing graft, obtain full extension, preserve quadricep muscle function, and achieve a normal gait, end quote, from Brody and ear gain. Also, quote, failure to achieve these ranges may lead to gait abnormalities and contributes to degenerative joint disease, end quote, from Brody and ear gain. Right after surgery, patients are placed in crutches and a postoperative brace is used. The knee brace must be, quote, locked in full extension for 1 week. After 1 week, unless the patient has had a meniscus repair, the brace can be unlocked, end quote, from Yabrowdy and Irrigang. ACL rehab begins immediately after surgery, and the simplest tasks are now extremely difficult for patients to achieve. Some exercises patients are given out after surgery are, quote, heel slides, hamstring stretches, and active knee flexion exercises, end quote, from Yabrowdy and Irrigang. Nearing the end of the postoperative stage, activities should be advanced. Quote, flexibility and strengthening exercises for hip muscles, hamstring, and soleus muscles should be initiated and emphasized, end quote, from Yabrowdy and Irrigang. After 6 weeks and confidence that the patient is ready to continue in rehab, the next stage is strengthening and neuromuscular control. Yabrowdy and Irrigang write, quote, the main goals during this stage are continued progression in strength, neuromuscular control, balance activities, and preparation for return to activity in sports stage, end quote, from Yabrowdy and Irrigang. New exercises are introduced to the patient, including, quote, wall slides, partial squats with weight distribution on both legs, and progression to step-up activities, end quote, from Yabrowdy and Irrigang. Focusing on hip strength and knee location while jumping is important to decrease a chance of an ACL injury. Quote, weakness of hip adductors has been found to be associated with collapse of the knee and non-contact ACL injuries, end quote, from Yabrowdy and Irrigang. The last phase is the return to sports phase. Quote, a minimum test battery of hopping tests and quadriceps strength should be performed, end quote, from Brindley. This process is not fast, and there are many careful steps that need to be taken before returning to play. Quote, return to competition should be stepwise, ensuring the athlete has achieved pre-injury conditioning levels and performs a prevention program at least 2 times per week during one athletics career, end quote, from Brindley. The time someone returns to play depends on the severity of their injury and how successful the surgery went. There are arguments that return to play should not be started until 2 years after surgery. There have been more studies and concerns about patients returning too soon. Quote, a young athlete who returns to sports within 1 year is 15 times more likely to suffer a second ACL injury than an athlete with no medical history of a knee injury, end quote, from Nagelli and Hewitt. In order to prevent this timely injury and gruesome rehabilitation, Odd Eagle Olson in the article Exercises to Prevent Lower Limb Injuries in Youth Sports, clustered randomized control trial, conducted a trial with young athletes. He provided players with exercises that focus on, quote, the quality of their movements with emphasis given to the core, stability, and position of hip and knee in relation to foot, end quote. After the experiment, he found that there were less injuries to the knees and ankles of those athletes than the group that did not do preventative training and beneficial warm-ups. He adds, saying, quote, preventative training should be routine in pivoting sports, end quote, from Olson. New studies and changes in technology will continue to inform medical workers on how to give someone the best outcome after ACL injury. In their article, ACL Tear, P. Chambit writes about the history of the surgery process, saying, quote, ACL reconstruction has evolved considerably over the past 30 years, end quote. As my speech progressed, I gave a detailed description on the function of the anterior cruciate ligament and injury to this ligament and the rehabilitation process. I hope that many of you know now how the ACL can be injured, the surgery process, and ways to prevent this injury. Here's my works cited. Thank you for listening.